I'm Dr. Micheal Wachter. I'm a psychiatrist here at Muir Wood, and I've got over 20 years of experience in working with adolescent addiction. A lot of times people hear about a psychiatrist and they assume that that means medication, when really the fundamental roots of psychiatry have always been in case formulation. There's been a drift away from psychological case formulation in recent years in psychiatry, but it's really fundamental to making a comprehensive assessment of the client and the client's family. My thought to parents who are wondering if they should intervene or how they should respond to early signs of substance use are obviously first and foremost, try talking to your adolescent, but starting to reach out and make contact with mental health providers is really critical at that juncture. When we conceptualize adolescent addiction, it's extremely rare that there's a fundamental addiction that's taken hold like you see in adults. Occasionally we'll have an advanced user of a certain substance where that's a primary consideration, but in the vast majority of our cases, the early phase of the addiction that we're catching in our population has to do with management of deeper feelings, deeper dynamics, deeper stressors, and essentially deeper underlying material. And our goal is to try to get at what that deeper underlying material is and has been, and make a prediction about where it's going so we can tailor our treatment. With adolescents, we have to approach the disease from a family standpoint. And that doesn't just mean figuring out who in the family has had addiction and passed on addictive genes. What it really means is that we have to understand the relational component in the family system. So that means how is affect managed, like depression or anxiety or anger, and what goes back and forth, and where are their connections and where's their isolation. So these are not just restricted to addiction, these are family dynamics, and if we don't address those in our treatment, then we'll fail to grasp the fundamental aspect of each family that makes it unique. When we move past clinical jargon, treatment is fundamentally about relationship, and it's an intimate relationship that involves emotion, thought, feeling, and an actual experience that we have with our patients and with our patients' families. As we move through the arc of treatment and think about what it's like when we make initial contact, what happens throughout the course of treatment, and where we are at discharge, I find that development and that evolution to be interesting and unique, and that's what keeps us motivated for treatment here.